How GLP-1 medications are reshaping healthcare spending and the economics of obesity. For years, the healthcare system has been throwing billions at obesity-related diseases, diabetes, heart disease, joint issues, you name it. But now GLP-1 medications like Ozempic, Wegovy, and Mounjaro are shaking things up in a big way. These once-weekly injections aren't just changing waistlines, they're completely reshaping healthcare spending, from insurance policies to hospital budgets and even the pharmaceutical industry itself. But here's the big question. Are GLP-1s actually saving the healthcare system money, or are we just shifting costs from one place to another? Today, we're going to have a look at how GLP-1 medications are transforming how we spend money on obesity and healthcare, who's benefiting, who's losing, and what it means for the future. Let's get into it. The cost of obesity before GLP-1 medication. For decades, obesity has been the biggest financial burdens on the healthcare system. The U.S. alone has spent over $173 billion per year on obesity-related healthcare costs, and that number has steadily been rising. Obesity is not just related to extra weight. It's a major risk factor for some of the most expensive chronic diseases, including type 2 diabetes, heart disease, blood pressure, stroke, sleep apnea, and even certain cancers. One of the biggest costs tied to obesity is diabetes care. Treating diabetes isn't cheap. The American Diabetes Association estimates that people with diabetes spend nearly $16,750 per year on healthcare expenses, more than twice that as somebody without diabetes. That includes insulin, blood sugar monitors, doctor's visits, and hospitalization due to complications like kidney failure, nerve damage, and amputations. Many of these complications lead to lifelong disabilities that require ongoing medical care. Heart disease is another major expense linked to obesity. Excessive weight puts extra strain on the heart, increasing the risk of heart attacks, strokes, and hypertension. The cost of treating heart disease is enormous. Just one bypass surgery alone could cost anywhere from $30,000 to $200,000, and that's not including the long-term medications like statin and blood pressure pills, which many people have to take for life. Beyond the obvious complications, obesity also leads to joint problems that require expensive surgeries. Carrying excessive weight puts more strain on the knees, hips, and spine, leading to osteoarthritis and mobility issues. Many people with obesity eventually need knee replacements or hip replacements, which can cost $30,000 or more per surgery. And then there's sleep apnea, the most common obesity-related condition that requires expensive CPAP machines and ongoing sleep studies. Left untreated, sleep apnea increases the risk of heart disease, strokes, adding even more cost to the healthcare system. But the cost of obesity isn't just medical. There's also the hidden costs that impact businesses and taxpayers. Obesity leads to higher insurance premiums as employers have to cover more expensive medical claims. It costs in lost productivity, as people with obesity are more likely to take sick days or become disabled due to their health condition. A study from the CDC found that obesity-related absenteeism costs the U.S. businesses more than $6 billion per year. For years, the medical system has been trying to tackle obesity with diet programs, gym memberships, and even weight loss surgeries, but long-term success rates have been low. The cycle of losing weight and regaining it has kept obesity-related healthcare costs high, and that's where the arrival of GLP-1 medications, which are significant and sustainable weight loss, have completely disrupted the system. How GLP-1 medications are changing healthcare spending. GLP-1 medications like Ozempic, Wegovy, Mounjaro have completely changed the conversation around obesity and healthcare costs. These drugs are not only helping people lose weight, but they're preventing or reversing chronic diseases, which could potentially save billions in the healthcare industry. One of the biggest changes is in diabetes care. Before GLP-1 medications, people with type 2 diabetes often needed lifelong insulin therapy, which is expensive and difficult to manage. A single vial of insulin can cost between $100 and $300, and many people need multiple vials per month. On top of that cost are the glucose monitors, test strips, and insulin pumps, which add thousands of expenses each year. But studies have shown that GLP-1 medications can reduce or eliminate the need for insulin in some patients by improving insulin sensitivity and blood sugar control. This means that people wouldn't need insulin prescriptions, fewer hospital visits for diabetes complications, and potential billions in savings for the healthcare system. Another major shift is happening in heart disease treatment. Just losing 10% of your body weight, which is common for people with GLP-1 medications, has shown to significantly reduce the risk of heart attacks and strokes. Fewer heart attacks means fewer expensive bypass surgeries, stent procedures, and lifelong medications like blood thinners and beta blockers. Insurance companies spend billions on heart disease treatments every year. So if GLP-1 medications can reduce those risks, the potential cost savings are massive. Hospitals and healthcare providers are also seeing changes in patient trends. For years, the go-to treatment for obesity has been bariatric surgery, which costs between $15,000 to $30,000 per procedure. While bariatric surgery is effective, it requires permanent lifestyle changes and carries surgical risk. Many people, once considering the surgery, are now opting for the GLP-1 medications instead. If fewer people are undergoing bariatric surgeries, hospitals lose revenue from these procedures. But at the same time, fewer people end up needing intensive post-surgical care. This shift frees up hospital resources for the critical services, potentially improving the overall efficiency in the healthcare system. Insurance companies, however, are struggling with the cost of GLP-1 medications. While these medications can prevent long-term medical expenses, they come with a massive upfront cost, over $1,000 a month for each patient. Many insurers are hesitant to cover the obesity medications. The insurance company's dilemma comes down to timing. Most insurers think short-term, meaning that they're focused on immediate costs rather than potential long-term savings. If a potential patient with Wegovy for a year loses 50 pounds and then switches job to a new employer with different insurance provider, the first insurance company never sees the financial benefit of the weight loss. That's why insurers are reluctant to pay for GLP-1 medications, even though they can prevent future hospitalizations. Despite these challenges, large employers are choosing the GLP-1 medication for their employees, recognizing that healthier employees lower long-term healthcare costs and increase productivity. Large companies and manufacturers and even government agencies are starting to include weight loss drug coverage as part of the benefits, which could lead to broader insurance acceptance in the future. Another interesting shift in the healthcare is how manufacturers are profiting off of the GLP-1 medications. Novo Nordisk, the maker of Ozempic and Wegovy, and Eli Lilly, who makes Mounjaro and Zepbound, are raking in billions of revenue as more patients demand these medications. Drug companies are racing to develop newer, longer, faster acting, and even more powerful versions of these GLP-1 medications. While pharmaceutical companies are winning big, the other sectors of the medical industry are seeing potential losses. If GLP-1 medications prevent obesity-related diseases, fewer people are going to need diabetes medication, blood pressure pills, cholesterol pills, and even joint surgeries. Some companies have made billions from obesity-related conditions. They may see their profits shrink if these drugs become the standard for long-term care. GLP-1 medications are changing healthcare spendings in ways that we've never seen before. With the upfront costs high, the potential long-term savings could be a game changer. The question now is whether insurers, hospitals, and policymakers will adapt to this new landscape, or will they continue resisting the change? That is the dilemma. Well, thank you for watching, and please like, share, and hit that subscribe button, that notification, and thank you for watching.